Thank you very much for that welcome. And I am happy to be sharing some of these thoughts and research with all of you. A little bit of background and kind of where I'm coming from. This talk might be a little bit different from what you're used to hearing, basically because my degree is in geography. I kind of have only recently come into the health world, and my entire perspective is geographical. And because of that, I'm going to use this as an opportunity to share some of those thoughts and theories with all of you, and how we can apply these things to mHealth and health problems. So that's me with a globe. My favorite thing in the world is the world. And the reason it is because it represents space, and in a way it represents time. And these are two aspects that really matter for health, mainly because everything happens in a space and at a time. And these are the two kind of layers that really will meld with other features to create a context. And why do we care about context? Because context is essentially what's influencing all kinds of health-related things, biological pathways and feedback loops, transmissions of disease, and decision-making and health behaviors are all going to be influenced by context. And space and time, as the foundational layers of context, are things that are really worth us looking at when we try to consider how to design an intervention or how to collect information about people using sensors or other types of technology. So to give you an idea of the types of questions and the types of thoughts that I'm consistently thinking about, it really is coming from this geographical perspective. So where and when do healthy and unhealthy exposures occur? How much of a certain exposure is necessary before it impacts health? What are the spatiotemporal patterns of health? Do different scales of measurement matter? Does it matter that we are putting these cell phones in people's hands and getting these minute-by-minute measures? Or can we just ask someone a question about their life, and is that enough to know something about their health? And then this whole idea of context. In what context do healthy and unhealthy behaviors happen? Can context help us predict health-related behavior? And those are two ideas that I'm going to come back to towards the end of this talk and really try to focus in on. So I pose this question in two different ways. How do we integrate mHealth into these questions? And that, to me, is my research. And I think for all of you who are probably tuning into this, you guys have the question from the opposite perspective, is how do we integrate these questions into mHealth? So basically, I want to see how I can pull mHealth into these geographical thoughts and questions, but I also want to help you all pull out some of the geographical concepts and integrate them into your research, into your mHealth research. So I'm going to start with a couple basics, some geographical concepts that I hope can help you all think through some of the problems you might be grappling with your interventions and your applications. So the first kind of basic is a really true basic, and that's what is space and what is place. These are concepts that get very easily confused, and people often don't think about what they're actually getting at when they think about putting geography and spatial technology into their intervention. So on the left, I have a representation of space. And space, I mean, there's a lot of debate around this in the field of geography, but in this application, you can kind of think of space as an empty cube. So there's an X, Y, Z plane, and then below I have a time arrow that represents past, present, future. And essentially, we can start populating this cube with actions, with things, with data. And that's when we start moving into place. So on the right-hand side, I've put some things into that cube. And that's when we start getting these ideas of people, places, surroundings, concepts, exposures. Those are all places. So why do we want to maybe disentangle these two concepts? So space can be very, very useful, and I honestly don't see it used very often in a lot of mHealth applications. Space can tell us things about distance. It can tell us, it can elucidate different spatial patterns. We can start learning about spatial autocorrelations. We can look at clustering of behaviors or clustering of exposures. We can see what orders things happen in space. We can really play with scale and resolution of our data, and we can identify hot and cold spots. And these are, I think these are the main examples that we can pull out of space, but there's a lot of others that we can look at. So just to go a little more in depth with some of these concepts, on the right-hand side, there's a graph of spatial autocorrelation by distance. And if you can imagine that you have a sensor that's telling you some kind of behavior, and as you move away from the home, you see that that behavior is pretty dispersed. And as you get farther and farther away, that behavior might start clustering more and more into specific locations. And so that's an example of where just the pure spatial distribution of something might tell us something about that behavior. Another cool example that I'm dabbling in right now is space-time cubes. And these are a great model for understanding how people in your cohort are moving through space and time and what they're doing throughout space and time. So you can just have the representation of their data through space and time. So that's kind of on the top. You just see where they're moving. And as you move up in the third dimension, that's time. But what's really neat is you can also include either a behavior or an outcome or something else, some kind of other variable in the representation. And you can start performing really awesome clustering and hot and cold spot analyses on these space-time cubes. So you can put your data in. There's a bunch of new tool sets that have come out in ArcGIS and ArcPro, where you can create a space-time cube of a certain behavior, and you can create these emerging hot and cold spot analyses. So you might see that a person who's wearing your sensor in a certain space and time where they have not engaged in a certain behavior in the past weeks, they're starting to, and it's an emerging hotspot that's coming out of something. And so you might want to investigate why they're starting to do that behavior in that particular spot. And vice versa. Maybe they used to do something a lot and now it's decreasing. So maybe you're trying to intervene on exercise in a park and you see every day they're exercising at 8 p.m. in this park. But 3 weeks into your intervention, you start sensing a cold spot. You start sensing that activity in that location is lacking. So that at that point, you might want to trigger an intervention message to say, okay, we need to get back and get back into into making this a hotspot. So those are some examples of what space can do for us. Most of what I see in mHealth right now is really operating in this realm of place. And what can place actually tell us? So these are going to be all the types of data and information that we have about our environment, about exposures, about access, and these are all different types of access. We can look at time access, obviously spatial access. We can also look at financial access, ethnocultural access, different kinds of ways that people might need access to either health promoting or places that have a burden on health. And then there's context, which again, I'm going to get back to because context is probably the most complex notion of all these things. So a simple example of using place, maybe we want to look at asthma risk for air pollution. We can sense air pollution on a person's phone to alert an individual to the surrounding air quality, but then we can also merge that with larger place-based data, such as the environmental air quality surrounding them. And then the two of those together might be triggering some kind of messaging about inhaler use, for example. So where this stuff gets really fun is when we start combining these, when we want to start combining space, place, and behaviors all together, and we can start coming up with really interesting and fascinating models to look at people's exposures and then look at their behaviors. So much of my previous research and research to date is really looking at exposure and trying to measure what a person is doing in certain spaces and times. And so this is a model from a paper published with Jacqueline Kerr and Jasper Piperin, I believe is how you pronounce his last name. And it's looking at what we can do when we have GPS data on somebody, GIS data on somebody, and accelerometer data. And just to backtrack one step right now, a quick definition here. GPS is Global Positioning System. That is what you get from using satellites to tell you exactly where somebody is. So most phones will have a GPS sensor in them. GIS data can come in all kinds of shapes, formats, and sizes, but it's going to be all those layers of place-based information you might want to get. Things like land use, pollution, green space, areas, points of interest, places that are promotive of physical activity. All those kinds of things you can get from GIS data. And then accelerometers are telling us where someone is being physically active. So when we look at each of these pieces of data alone, we get pretty disparate concepts. With the accelerometer, we can look at physical activity. GPS, we look at location. GIS, we can look at environment. But when we start adding the two of them together, we can start seeing these overlaps of seeing, okay, I want to look at with an accelerometer and the GPS. Well, I don't know where that person is exercising, or I guess what environment they're exercising in. I can start getting better measures of activities, speeds, and trajectories. But if I add in then the GIS, I can get this really awesome dynamic exposure measure where I get sensitive and accurate measurements of physical activity and sedentary behaviors within spatial contexts. And I can analyze that data in different ways. I can look at it through a lens of time, I can look at it through a lens of space, and I can look at it through a lens of behavior, and try to come to some kind of understanding of why somebody is choosing to exercise in certain places and at certain times. So we just published a paper looking at how we could understand if women who are exercising or being physically active in more versus less walkable environments, how that might be influencing their insulin resistance. And this was in a cohort of breast cancer survivors. So while this isn't mHealth in the sense that we're looking at smartphone real-time data, this is the type of data that is going to be coming into you if you have a smartphone and you're collecting accelerometer and GPS data. So moving into some more specific applications of how spatial data can be used in mHealth. So before giving this talk, I did kind of a deep literature review dive and really tried to suss out where I'm seeing the most spatial data and technologies being used in mHealth related applications. And there's really two areas. One is measurement, which I've been talking a bit about. And that's really, there's a huge space in quantifying the types of environments that people are being active or sedentary in. There's a lot of stuff out there assessing how often people engage in high risk zones for like smoking, drug use, or alcohol abuse. There's some stuff coming out now looking at life spaces, and life spaces are essentially the amount of space or the different types of spaces that people engage in. And so identifying life spaces for older adults. There's quite a bit of disease dispersion and tracking, particularly in third world contexts. And then location and context specific EMA. So ecological momentary assessment, someone is walking around and they get triggered an EMA, and then people are linking the responses to that survey back to the spatial environment that person is in. So the other way, the other kind of realm that I'm seeing a lot of this is interventions. And there's actually really not that much happening quite yet in the intervention space. The main things I've seen are tracking Alzheimer's or dementia patients if they leave safe zones. For example, if the safe zone is a house in their yard, and if they leave that area, then a warning gets triggered, and a family member gets alerted. Smoking and drug cessation interventions that are triggered by entering into a risk zone. So in these studies, it's usually the participant outlines areas where they are most likely to smoke or do drugs. So they select their zones before beginning the app, and then the app will trigger intervention messaging as they enter into those zones. And then in the third world context, there's a lot of stuff going on where people are trying to help individuals identify the nearest point of care for specific health issues, particularly in maternity and pregnancy cases. So when a woman becomes pregnant, helping her navigate where the best places are to go for her to get care. There's been a couple interventions I've seen that have recommended nearby exercise opportunities for children. But the phrase I most often see, and it makes sense because we're still kind of on the cusp of this, is I've read I don't know how many review papers on mHealth and the possibilities of mHealth, and I always see a sentence similar to this, which is the mobile device also provides location data, and that's it. There's no discussion of what can be done with that data. There's no discussion of how to best integrate spatial data into an intervention. So it seems like there's a lot of potential to be actually using that data in some kind of meaningful way. So what are the technologies that mHealth can employ to try to integrate spatial information into intervention or some kind of measurement? So if we want to measure space, we've got the GPS on the phone, which I'm sure all of you know is incredibly battery draining. There are programs to help minimize that drain and to only get traces every 5 minutes, 10 minutes, 15 minutes. Maybe only, there's some that I've seen that trigger the GPS only when a different sensor is being triggered. So if the accelerometer senses physical activity, then the GPS gets triggered. You can also utilize the Wi-Fi and the compass in the phone. And then there's a whole host of beacons coming out now. There's a lot of potential here in beacons, but it's they tend to be installed for very specific purposes for advertising. So, of course, like Starbucks is the great example where the Starbucks, every Starbucks has a BLE beacon, a Bluetooth low energy emitting beacon. And so if you have a Starbucks app and you get near a Starbucks, you're gonna get a message because the beacon is gonna pick up on your app and it's gonna send you some kind of either coupon or just let you know that there's a Starbucks right there. If mHealth researchers can figure out how to piggyback off of these types of beacons, those can be really useful, particularly within locations. So GPS, Wi-Fi, and compass really operate more on an outside level. Wi-Fi, you can start getting into locations. Beacons, you can actually look at incredibly precise location detail. So not only do you know that you're inside a store, but for example, in like a Macy's, you could know that you're by the makeup counter, or you're in the shoe department, or you're looking at children's clothing. Access point networks and distributed antenna networks are being installed in major cities as we speak by a number of larger companies like Google. And the hope is eventually we will also be able to piggyback off those technologies for more precise spatial measurement. If anybody has ever worked with GPS data, you will know how challenging and frustrating it can be. GPS data is it's great, but it's great, but it was never designed to specifically measure people in urban environments and with the kind of high precision that we're asking of it in a lot of these mHealth applications. There's a lot of noise, there's a lot of error in that data, and so pulling in some of these other capacities from the phone, like Wi-Fi or even beacons, could really help with getting better spatial accuracy. So in terms of measuring place, we also have a number of technologies and data sets available to us GIS data is by far and away the biggest and probably most useful set of technologies and data. Geographic Information Systems, that just basically refers to any kind of system that organizes spatial data. And so that, again, is going to be where you're getting a lot of your environmental and food environment or pollution or any kind of layer of information you might want about an environment, you can pull out of a GIS or put into a GIS. This kind of data is becoming incredibly available or incredibly easy to access, and it's getting very good. It still does have a lot of errors, and it really depends on what type of data you're looking at. So things like the food environment gets very messy very quickly. Even if you're looking at companies like Google or Yelp, there's still a lot of error in that data. But there's other data sets that are really good. And so you just have to, if you are pulling in GIS data into your app, you need to have some kind of idea of how good or bad it might be. Social media and network data, you can utilize that to really get a sense of different contexts and different trends going on in the area. Ontological data is great because it really, with the GIS data, you might just get, okay, this location is a Starbucks. With an ontology, you're going to get a lot more depth of information. So it's going to say coffee, social gathering, place where you can get coffee grounds for your garden. It's going to give you a lot more information about that place rather than just what that place is, but it'll kind of tack on other sets of information. And then, of course, historic data. And I down on the bottom, I have time, just as a constant reminder that in all of these types of data, you do want to consider time. One, because you want to know how things have changed or what might have been there in the past. But two, because time is going to be the element that ties all of this data and technology and information together. And so you have to kind of become your own little time lord in knowing the finicky things that time has to offer, things like different time zones and daylight savings time. And once you start trying to make sense of time, you have to start binning it in certain ways. So are you looking at minute by minute, 5 minute by 5 minute, hour by hour, day by day, month by month? These are all different decisions that might have to be made when deciding how to parse time, but also how to be parsimonious in collecting time data to use with your app. So the kind of third set of technologies that we employ are to measure behavior. I'm not going to go too much into this because this is really everyone else's specialty and not mine. So we have active and passive sensors. Again, we can employ social media and network data of a person to understand more about them. EMA is a really great tool. And then we can use traditional questionnaire and biomarkers. The only kind of hiccup with those two is this time component. So however you're measuring behavior or however you're deciding to employ an intervention, it's best if you can try to get your space, place, and behavior measures to be on similar time scales of measurement. That is obviously not always possible. You might be working with a GIS layer that only comes out once a year, and that's just how it's going to have to be. But instead of a traditional questionnaire, you might, if you're looking at reoccurring behavior, you're probably better off using EMA. Similar with biomarkers, if you can find some kind of sensor that can measure that on an ongoing basis, then that's better than in terms of tying it back to GPS data or movement data than just one measure. So I'm just going to talk about two of the mHealth interventions that I have been able to find. I'm going to talk about the two kind of most common ways that spatial data is used. The first is distance and access. So really this is all about identify where someone is, and then you want to know what's around them. And this is ideal for suggesting activities or tracking access of your participants. If you want to suggest to them, if you're working with a set of drug users. Maybe you want to suggest needle exchanges in the area. Or you want to just see what kind of needle exchanges are around them, and then whether or not they choose to use them. The kind of technology you need, you're going to need the phone location. You're going to need some kind of layer that identifies the points of interest that you have for your application. And then likely you're going to want some kind of behavioral or biomarker sensor to know what they're doing with the information that you've given them. Some little things to be aware of in these types of applications: time travel budgeting. I've seen a couple apps that I've tried that will suggest something to me that is completely unrealistic. I mean, like, I'm on my way to work, for example, and this is not an app that I've tried, but I can imagine that I'd be on my way to work and I drive by a park and the app says, hey, there's a park right there. Maybe you want to go for a walk. Well, I don't have time. So, how much are you going to be bugging your participant, and how much can you incorporate some sense of their time travel budgeting in order to make suggestions that actually make sense for them? You need to be aware of personal preferences. Are the suggestions you are making culturally and gender and other types of relevant to them? Which again is information that you will need to have in your GIS layer. So that's another bit of information you're going to have. And then just be aware of the underlying GIS data. As I said earlier, there's a lot of error in these types of data. Are you suggesting something that's actually there? Are you suggesting something that's closed recently? Are you pointing out things that maybe have yet to become, so that you just want to make sure that you're trying to minimize the error in your underlying GIS data sets. The other set of interventions are the buffers and geofencing. So this is essentially when you have a point of interest, and that point of interest is set up a priori, like before your intervention even starts. So it might be you decide that your points of interest are all food outlets in an area, or your points of interest are all places where a smoker tends to smoke. You identify those points of interest, you create a buffer around them, and that buffer can be whatever distance you think is applicable. And then essentially, as the person goes about their day and the app is running in the background, when their GPS sensor senses them within that buffer, then something happens. So either they get a message, or maybe you're just collecting information about how often they go into that buffer. And so this is ideal if you know the locations of interest that you are wanting to engage in with your audience. And it's also great for engaging your participants around those points of interest. You are going to need, obviously, the phone location. You're going to need your set of geofences and buffers. And then again, you're probably going to want some kind of behavior or biomarker sensor. This one, if you are messaging someone every time they go into a buffer, this is a great way to get participant fatigue on their end, especially if it's a layer that has a lot of geofences. So something like a food intervention that asks the participant every time that they get into a buffer of a food establishment. Well, you can imagine walking through an urban corridor where it's just restaurant after restaurant after restaurant. You wouldn't want to be sending these notifications every 5 seconds. Again, you need to be aware of your underlying GIS data. And then something that we consistently grapple with, and I think it's just going to have to be tried, and we're going to have to see what happens with different behaviors. But there's this question of, are you triggering or are you preventing a behavior? So if I'm sending a notification in a smoking cessation app to say, hey, there's a cigarette store right there, don't go in it. Well, maybe I didn't notice there was a cigarette store. Maybe I'm going to go in it now that you've told me that. So becoming really mindful of the type of message you're sending, what the best messages are, when you want to send that message. These are all questions you're going to have to ask. So in the last part of this talk, I wanted to kind of shift focus a little bit and now start talking about contextualizing and predicting health behaviors. So in a lot of the apps that I've seen, or the studies that I've seen, what we're really asking a lot of participants in in either identifying the behavior on their own, or even if the sensor is picking up the behavior, we're asking for some kind of engagement oftentimes to either confirm or not confirm that behavior. And so what, in my mind, where spatial and GIS and GPS technology can really make a contribution into mHealth is really moving towards better contextualizing of a behavior and then actually trying to predict that behavior before it even happens. And I want to take this step back to actually define what I mean by context. This is a term that gets thrown around a lot. And I think oftentimes people don't actually think about what it really means. And this is a simple Google, search definition of what context is, but to me, it really hit home that this is what I'm talking about. That the circumstances that form the setting for an event, statement, or idea, and in terms of which it can be fully understood and assessed. And that right there, to me, there's a lot of terms right there that are key. So we're talking about circumstances, we're talking about the setting of an event, and then probably most importantly, it's getting the right circumstances and settings so that we can actually understand why that event happened and what led to that event, and then maybe even what's going to happen once that event is done. So I just started kind of writing out the different things that might form a context, and following through these different ideas that we've talked about previously. So space, where has this person been previously? Where are they now? How often are they in this place? Where are they likely to go next? And if we talk about place, what type of place are they in? Is this a typical place for them or is it an atypical place? Why are they here? What time of day is it? What day of the week? What week of the month? How long are they going to spend in this space? How long do they have to spend in this space? Again, going back to that time budgeting concept. And then there's all kinds of things about the individual that will really form this context. Who is this person? What are the characteristics that may drive a behavior or a vulnerability for them? What types of choices do they usually make in this situation? What are their sensors saying about their current state of health? What are their sensors saying about their past state of health? And then the types of people that are around them. Who is around this person? Are these friends or are they random people? And what do most people do in this space and time? And these are just scratching the surface of the possible types of questions you can ask about when you're trying to form this idea of a context. And so why am I harping on this? Why do we care so much about, or why do I care so much about this context idea? Is essentially if we can accurately identify consistent context for behaviors or adverse health events, then we may be able to actually predict those events or behaviors before they happen. And this may seem like a obvious thing, but I think right now we're really our definitions of context are very limited. We're really just focusing on looking at a sensor and seeing what that sensor is telling us. And we start seeing a spike of something happening. So maybe physical activities is starting to go up and we're saying, okay, they're exercising. Well, obviously. But what if we could actually look at the place they're at, the places they were before then, the time that of the day it is, look at this person in detail and put all that together to say, you know what, they're probably going to exercise in the next 10 minutes. I want to send a message or do something to capitalize on that moment. And a big idea in this, and this is really pulling from market big data type stuff, is how can we start binning our populations into certain types of people, and then how can we use that information to better our prediction models? So we really need to start trying to look at larger data sets and combining those with our N of 1 models. So we know there's an underlying type of behavior that this group of people might engage in. And when I say group of people, I'm talking about 35-year-old mothers of 2 children who live in urban San Diego. That would be me. So what are the things of other people like me? Where do they go? What do they do? What are their types of behaviors? And then how can I pull that data into my specific example? And then if we can take all that data and put it into machine learning or other big data methods for analyzing context on the fly, we can actually start moving into these predictive models. So here's one example that our team here is currently working on. We're trying to use these spatial, temporal, and behavior predictors of adverse eating events. And when I say adverse eating events, essentially, we want to be able to stop people before they go into a fast food restaurant to have a high sodium or high fat meal. And so we're developing this predictive model coming out of all these different factors. So we have a baseline prediction model for all people that we've developed from a sample of individuals. And we have a couple primary inputs, the time of day, and then the ratio of fast food to other food outlets in the area that they're at. And then we might want to enhance that model with general environmental features like parks or greenness. We might want to put in some actual user input. So before the app even starts, we might ask them, when are the usual times that you eat? What are some of your favorite fast food outlets? And then some of their basic demographics and health status data, like such as, are they already obese? And then we want to get some baseline data from them as they use this app. We want to see what kind of sensor data can we get from them, and see if we can sense out previous adverse eating events and understand what the context was for those past eating events. When they tend to exercise, because if you're going to exercise, you're probably going to want to eat soon thereafter. And then current real-time behaviors, things like heart rate and stress, and then their movement, what speed and what direction are they moving in. And all of these factors can be put into this predictive model to try to come up with what you might say is a threshold. Obviously, you're not going to be able to predict this 100% of the time, but you can get to a point where maybe you have a 90% confidence, for example, that it looks like they're about to engage in a adverse eating event. And then you can trigger some kind of intervention message, and you can see, A, were they even about to engage in that event? And then B, if they were, maybe was your intervention able to help them hold back? Another, one of the only examples I've been able to find of this in reality being implemented is by Kowalczyk and a bunch of other authors. This was a very short abstract that I read, and it was called "Predicting Cravings and Mood 30 Minutes into the Future." And in this study, the authors tracked mood and cravings in two groups of methadone-maintained outpatients, and they actually used EMAs for a 28-week time period, which is a huge time period to be doing EMAs with people. But they used that data to come up with the ability to put that into a machine learning model with the GPS data, the 6.5 hours prior to each EMA. And they actually were able to then pretty well predict heroin and cocaine cravings, positive, negative, and stressful moods, just using only GPS and GIS data about neighborhood disorder. When they actually added in these person-level predictors for each individual person, they significantly increased their accuracy of cravings and mood. So their study really goes to show that this is absolutely possible, and I think we're on the cusp of some really exciting ways to be using spatial data to help predict actual events. So just some final thoughts to wrap this up. I like to employ optimism and caution in equal balance. We can do some really amazing things with space, place, time, and behavior data. I think there's so much room in the mHealth realm to start implementing more spatial data. We do need to be very careful of the error and the noise that this type of data is putting into our models. There's a lot of error. And so whenever if someone ever tells you like, oh, I'm just going to download all this data from Google, your alarm bells should be going back in the back of your mind, because that data, as good as it is, there's a lot of error. And I mean, if you're talking about just trying to get a general idea of a landscape, that's okay if there's some error. But if you're talking about precisely being able to tell someone whether they should or should not do a certain behavior because of that background data, then you need to be really mindful of how much error is in that background data. My third kind of major thought is right now, a lot of our studies really do tend to be in very small populations and very specific types of people. None of this stuff is ever going to resonate with other populations if we don't start pulling in data on other types of people. And so we need to start figuring out how we can get more of this type of data into our models. And then finally, to me, the whole mHealth realm, it has a bit of a Wild West mentality, which I think is great because it generates so many awesome ideas. But I'm often wondering, where's the theory? And that's just where the cartoon that speaks to me on that, especially with the spatial implementation. There's a lot of people that are just saying, let's just use GPS, but there's very little thought and theory behind how that data might actually make a better intervention and tell us more about someone's health habits. So that's all that I have, and I'm happy to hear from people about any projects you might have, and you can email me at this email, and I can take questions now.
Great. Marta, that was terrific. Thank you so much. So you may use, those of us who want to pose questions may use, just unmute yourself and you can communicate with Marta.
Hello everyone. Can you listen?
Yeah, Kevin, go ahead.
Oh, thank you, Marta. That was a great presentation. My name is Kevin. I am a medical doctor from Guatemala, and I am performing some basic data analysis with some data. And I have a question: what software do you prefer or use for manage these data sets?
Sure. There's a lot out there. So with the GPS and other sensor data, you start getting really, really huge data sets. Honestly, you're going to need to start setting up databases to manage all that data, especially if you want to do any kind of processing in it. So we use PostgreSQL for our GPS data. In terms of visualizing, I used to shy away from ArcGIS just because it's not able to visualize these huge point cloud datas. But recently, ArcPro is a lot better in doing that. But then you can also you can look at R. R has a lot of really great spatial packages, and a lot of really great spatial statistics are actually being developed in R that you can use to try to help break down the data.
Thank you. Thank you.
This is Shahin from Memphis. I think, thank you. Number one, thank you for your presentation. And two, my question is, what are your thoughts, just kind of generally, and from your experience with respect to privacy, both with respect to individual participants' understanding and expectations of privacy, data privacy and confidentiality, and just kinds of any kind of methods that you're familiar with for any kind of transformation, obfuscation, or dealing with these data in a way that can preserve these privacy and confidentiality aspects?
Yeah, that is a really great question. So I have very mixed thoughts about this. And I'm currently actually sitting at Camille Nebaker's desk, who leads this core network that really deals with a lot of the IRB and ethical issues surrounding mHealth. And if Camille was on my shoulder, I would say that we obviously have to be incredibly concerned about this stuff. The devil on my shoulder says that so many people are downloading apps currently that and they're agreeing to such ridiculous amount of data sharing that I don't want. I mean, I guess I don't say that that we should just do that too, because I think we obviously should be held to a higher standard. But sorry, I'm trying to untangle some of my thoughts while I answer this question. So the problem is not the problem, but a big issue that I think right now mHealth has is we don't have a good enough data pool. We need more information about more people and their behaviors in order to start making these kind of better predictive models for smaller groups, for smaller populations. And so until we're able to start pooling that data in some kind of way, I don't think we're going to make a lot of progress in this kind of predictive realm. So in that regard, I think the sharing of data and the putting of data into some kind of repository is really important. On the other hand, yeah, are we going to get people to be contributing their GPS and health behavior data to repositories like that? I have a hard time imagining it. Furthermore, but it's not impossible, I guess, is what I guess I want to stress. There are, and we have one here, there are HIPAA-enabled environments that are able to take streaming data and put it into incredibly secure environments. So I think it's all possible. I just think we're kind of still a long way off.
Marta, let me ask you this question. So what kind of collaborations or collaborators do you look forward to? People who can use your kind of expertise?
Sure. I definitely am really interested in collaborating on moving into this kind of predictive realm. And being able to get hold of data sets that have really great spatial data. I think a big area of interest that I would like to collaborate with is people that have really great validation data. So anything that you might be getting data in from the sensor, but actually being able to tell, okay, what is somebody doing in that particular spatial context? There's just a lot of potential right now, I think, in expanding what we can find out about a person's context with GIS and other technology. So yeah, looking for really great spatial behavioral data sets.
Thank you. Or I guess you may have questions coming your way through the email. So I probably should say this was, Marta, really a terrific presentation. I see my grad student shaking his head. And really, we appreciate you being here, bringing a completely new perspective to our mHealth seminars. To the audience, just a reminder that these webinars are recorded and are available on our MD2K's mHealth Hub, and you can access them or share them asynchronously. I want to thank you, Marta, and the audience for joining us, and we hope that you will join us again at our one of our upcoming webinars. Thanks again.
Great, thank you so much.